Hey everybody, we're back in the studio today talking to professional doula Emily Bruno. We're going to touch base a little bit today about choosing the right provider, finding your voice, asking the right questions, and making sure you get that birth that you want. And even when you don't, making sure you have the care provider and the support system to work through it. So I hope you enjoy it. You're listening to the Latched Mama podcast. I'm your host, Melissa Wirt, business owner and tired mom of 5. Join us each week as we talk about pregnancy, nursing, parenting, and all things motherhood. Emily is our resident doula expert. She is here to talk about birth and everything that goes along with pregnancy and the fun stuff that leads us all to hopefully eventually breastfeeding in this lovely community. How are you?
I am well. Thank you for having me back.
You're welcome. Anytime. So I was thinking the other day about kind of how we've gotten here and how I have this wonderful business, but I also have an awesome family. And I was thinking about all my births and, you know, those like pivotal decisions that you make in life where you look back on them and you're like, hell yeah, like that was an awesome one. Mm-hmm. And you don't really know how you ever really landed there. And when you made the decision, you didn't really think it was a big deal, but you just did it. And all of a sudden it like kind of changed the course of your life. Mm-hmm. So I was thinking like when I first got pregnant, my oldest child will be 8 in April. I don't know why, but I found my way to a midwife and I found my way to a birth center at the time that was kind of attached to a hospital. It was brand new. It didn't really have a whole lot of data behind it or success or reviews. I didn't know anything about it, but for some reason I found my way there. I think I probably had watched The Business of Being Born like most people do before they find their way to something different in terms of birth. But I found my way to a midwife and it 100% transformed how I had that baby and how I had the 4 later babies as well. So I wanted to kind of chat today about kind of care providers and different choices that we all have when we find out that we're pregnant, and the different kind of ways we can be treated throughout pregnancy and through birth, and once again kind of why it all matters a little bit, because I had amazing experiences, and at the end of the day I'm proud of myself, but I also am very happy with kind of the decisions that I've made in terms of care providers and stuff like that.
Yeah.
So I assume as a doula, you I don't know if you get asked this or you have the opportunity of seeing a lot of different care providers in action, and just kind of wanted to dive in a little bit and see, you know, why does it matter, and you know, the different outcomes that can come about through the different decisions we make.
Definitely. When you were talking about your births just now and how you kind of like stumbled into the birth center, I was thinking about a little bit about my own birth experiences because I've been a doula for 13 years and my oldest is 11 and a half. So if you do the math, I became a doula a year and a half before I welcomed my own first child. And I changed providers when I was about 7 months pregnant from a hospital-based midwifery group to a home birth midwife.
Which I'm going to stop you right there. Yeah. It's okay to change providers. And I think
100%.
That's like one of those misnomers that people have, that like they have to have the person who's been giving them pap smears since they were 18 help them have a baby.
Right.
Absolutely not.
No.
Absolutely. And you can change throughout your pregnancy. You can change up until you're I mean,
I have not personally been there when this happens, but I have talked to people who have left one hospital in labor to arrive at another one to have their baby there, because they want to get because they're not getting the care that they want at the first hospital. So like you really can at any point, it's your body and your baby and you can do whatever you want to do with it.
Absolutely.
So yeah. So when I changed providers at that time, I had no idea how critical it was going to be to my long-term mental health and physical health.
Absolutely.
Because as it turns out, I had a transfer with my home birth to the hospital and I ended up having a C-section. And I'm certain, I there is not a piece of doubt in my mind that my C-section was necessary. Like, it made the critical difference between life and death for at least my daughter, if not maybe both of us. It wasn't an emergency. It was just necessary.
Did you know, sorry, I didn't interrupt
No,
you,
it's
but
okay.
did you know going into the transfer situation and going to get the C-section that this was the option of having your baby? Like this was how your baby was supposed to be born?
No, I was still hoping for a vaginal birth.
Okay.
So the very, very abbreviated version of my birth story for my first is that labor started at home. I labored for about the first 24 hours or 30 hours, something like that, at home. But it became obvious that I was stuck at 8 centimeters and it was no longer what's considered normal for a home birth. It wasn't unsafe. It was just that we needed to use some tools. So the goal with going to the hospital is to use the tools, get the epidural, get the Pitocin, have a baby. And I ended up getting both of those things, which were amazing. And I got to 10 centimeters or completely dilated, and I pushed for a couple of hours. But she was absolutely not going to come out. I ended up having a C-section. Now, I can talk about it without crying right now. But that was a totally different story back then. And in the moment, it was awful. Like, it was a really, really awful decision. Like, I bawled for a while before I met my baby. The thing that is critical for me is that when I look back at my birth, every single decision from start to finish was mine. Like, with hindsight, I know that my midwife probably would have done a bunch of different stuff earlier on if I'd given her permission to do it, but I hadn't, and they were my choices. And then in the hospital, they were my choices. And I have all of these memories of my midwife and my doula and my husband asking me what I wanted to do and talking through options with me. And it's that ownership of my birth experience
Absolutely.
that makes it now positive and something that I can look back on and talk about in a really healthy way.
Did your midwife follow you to the hospital? So
she did, yes.
Okay.
So she was with me. She and my doula were with us at the hospital, and there when I met my daughter in the OR with me and everything, helping with the first latch, just taking care of me, all of those things. So I know that it's out there. I've experienced it myself. I know the difference that, talking through options and choices can make. And it really is why I talk so much about this subject with my clients and my students in classes.
So basically, if I understand you correctly, what you're saying is that with the proper team in place and with the proper lines of communication, even a birth that goes completely differently than you ever expected, you can still talk about it with a smile on your face and know that it was the way it was supposed to be.
Yeah, because it was mine. It was mine. Everything, start to finish, all of my choices.
So how do we get there? How do you find, see, the funny part about all of this is that Emily and I share the same midwife, and she's pretty much a little bit of a, I don't know what we want to exactly call her, other than I don't think that there are many of her in this world, but she's very special. But I assume that midwifery care in general is going to give you some of those same opportunities and gifts that she's given both of us.
Yeah.
So where do we go? Like, how do we find our way to the right person to help us have a baby?
Right. Well, so first, I think it's important for people to just have a little bit of an understanding about like what we know will lead to a safer birth, healthier outcomes. And in
healthier, you mean not just a healthy baby, healthy mommy. Like,
yes,
we're talking
all levels of health: mental health, spiritual health, physical health.
Okay.
Everything. And when I like ruminate on birth and pregnancy, and when I talk to clients and students about it, I start with this understanding of like the fact that we're mammals and we're made to give birth, and that science and the medical community kind of in general has an understanding that physiologic birth leads to better outcomes. And by physiologic birth, I mean birth without a lot of interventions or unnecessary interventions. And then it goes beyond that into the way that we're treated and the environment in which we give birth. We know that we're going to be more relaxed in a private space with low lights, with doors closed, with gentle voices, with soft touch, in an environment where we feel safe, and all of the hormones that we need for our labor to progress are able to be produced because we feel safe and like we can do it. So physiologic birth has many components. It's the quiet, it's the privacy, it's being able to push in positions that feel comfortable for us, to be able to be active and moving and upright in labor. It extends into the postpartum with keeping our babies close, doing skin to skin, being able to talk with them and to bond, being able to nurse on demand and with frequency. So
if the studies are there, and we know all of the things that you just mentioned lead to more successful births, then why is that not what birth looks like most of the time? Or why is that not even how it's depicted in the media or
Well, I'm going to be a little facetious here, but you can't bill for low lights.
Yeah.
You know, you can't bill for soft touch.
Yeah.
But you can bill for a medication that's being administered. It's really just that the system that we've built to birth our babies in is one that's designed for ease of data collection, for profit. I mean, we are a medical system that's designed to turn a profit. It's not designed for best outcomes. And this isn't just my opinion. I mean, in the developed world, the United States ranks last for maternal and infant morbidity and mortality. Like, we are not saving any mothers or babies by doing more surgeries and having more interventions. In fact, we know that we're losing them, and we're having a lot of like near-death experiences. We tally the maternal deaths, but when we look at just like the maternal injuries or the infant injuries and hospital stays and stuff, then the numbers get even crazier.
Yeah, so, and then you even take a step further back and you say, well, also how many women are we sending home that haven't had this birth that went the way that it probably could have or should have, and we're sending them home, and now we're looking at depression and anxiety and things that didn't necessarily need to be there, because we forced them into some sort of birth situation that was not as preferred as it could have been,
or optimal for them.
Absolutely.
Yeah. And I mean, so I'm a C-section mom. I had a C-section, again, like absolutely medically necessary. And I want to put a little caveat here that I think that even if somebody says, like, just decides on their own, I want to have an elective cesarean, that is their right.
Absolutely.
Like, every person giving birth should be able to make the decision that's going to be best for them. Like, end of story. But I think that we need more information to be able to make those confident decisions. So I had a C-section, and then I had a VBAC, a vaginal birth after cesarean, with my son. So I have personally experienced both. I can say, as a mom, as a doula, as a childbirth educator, as a person in America, I can say that C-sections are necessary and that I'm thankful for them. And I can also say that we're doing way too many, like way too many. Our cesarean rate is actually climbing again. It was going down for about 8 years, and now we're on an uptick again. So it's about 1 in 3 birthing people in America that are having a C-section. So that's about 33%. The World Health Organization and the CDC and the National Institute of Health and the Healthy People 2020 Initiative, all these different organizations, they all agree that our safe cesarean rate in the U.S. should actually be between 10 and 15%. They say if we're doing any less than 10%, then we're having some unnecessary injuries to people, things that could be prevented by C-sections. Mm-hmm. And if we're doing any more than 15%, then we are unnecessarily harming people with the complications that are associated with cesarean birth. So we should be between 10 and 15%, and we're actually at 33%. Again, I had a C-section, thankful for it, but I can also tell you that C-sections have a lot of immediate and long-term complications and health risks associated with them. So when we're choosing our providers and when we're learning about how we want to have our babies and how we want to welcome them and what's going to be optimal for our health and well-being, we really need to start with this understanding that when we can safely get the vaginal birth, it is going to be healthier for the birthing person and for the baby the overwhelming majority of the time. So we have to start with that basic understanding. And then from there, we can move forward with how we want to give birth, choosing our provider, and exploring all of those options. But it is why it's critical. And sorry, I know you were about to say something, but real quick, while this thought is in my head.
Emily is very passionate about this, if anybody can
While
tell.
this thought, I talk about it a lot. While this thought is in my head, there are providers out there that have a cesarean rate of between 10 and 15%. Like physicians, I can make a mental list in my head right now of doctors in Richmond that I know are keeping their C-section rate between 10 and 15%. And I also know that there are doctors in Richmond that are doing C-sections on more than 70% of their patients. And that story repeats across the country. You get down into like the deep South, like Mississippi, for example. There are hospitals with 88% cesarean rates. It is sickening.
So are you allowed to just ask a physician what their C-section rate is? Is that?
Oh, yeah. Yeah, absolutely.
Will they tell you
Now, I think any provider worth their salt should know what their cesarean rate is. They should know what it is for that month, that year. Like they should know the rates of the other providers in their practice, and they should be forthcoming with that information. And if they're not, that's a red flag that maybe they aren't providing evidence-based and optimal care. So.
Wow. Okay. So where do we go from here? I mean, I know I'm a fan of midwives, but they're not the option for they're not everywhere, correct?
Right, correct. Well, so nurse midwives are legal in every state, can practice in every state. And nurse midwives have a master's level education. So they are care providers. They can do all of the same things in pregnancy that a doctor can do, short of surgical birth. So they can't do a vacuum. They can't do forceps. They can't do cesarean birth or C-section. But everything else they can do in prenatal care. And therefore, low risk pregnancies for healthy moms, healthy babies. And then, they're legal and able to practice in all 50 states. We need more of them. We don't have access in like every city or every town to them. But even if you don't have access to a midwife, you can still get access to evidence-based care. So that's what we try to help encourage people to advocate for and to find. And, sometimes people are going to have a high-risk pregnancy. Maybe it's hypertension or gestational diabetes or maternal age or whatever it might be, multiples, things where it's going to require having an OBGYN to provide their care for them. That's okay. That's great. You can still go into your appointments and your birth expecting to be an active participant, like the decider, the decision maker for everything that happens. And you can still expect and demand respectful care from your provider, evidence-based care.
It's so funny to sit here and talk to you. You haven't been pregnant in a while, and I've not pregnant right now. Just came off of birth. But it's interesting because, I have this like, yeah, women need to speak up for themselves. They need to do this. They need to do that. But pregnancy in general emotionally can make you feel a little bit more vulnerable. It can make you feel, you know, a little bit less strong in terms of your voice. And it's so interesting to me because women do tend to lose their voices a little bit, and they do tend to kind of just shrivel back to, you know, the standard person who they've been seeing, or, you know, it also is such an overwhelming time that it may feel overwhelming to change care providers or start over again, or even the insurance aspect of it alone is like, hey, how do I stop care here when I've been paying them? And I know it doesn't feel right, but isn't it just easier to stay here and just see what happens? We hear it all. And it's so sad and terrifying to me because I know how much it matters.
Right. Well, and I don't expect that I can fix anything. And honestly, I don't think it's my responsibility to fix anything. I agree with everything that you said. That message is out there. At least you have a healthy baby. Like, it's infuriating. I know so many people that have heard that. Like, yeah, that happened to you. It's really sad. I'm sorry. But at least you have a healthy baby. And I can't change that. I can't make those people not say that. But what I can do is tell every pregnant person that I meet, I can tell them, you matter, and the way that you feel matters. And yeah, of course you want a healthy baby. Like, that goes without saying. That's like the foundation of knowledge here, but it goes so far beyond that. And just because you also want to be well taken care of and respected and safe, that doesn't mean that you don't want a healthy baby. Just because you want to ask questions and you're concerned about like what happens to your vagina or what happens to your long-term blood pressure or your abdomen or your pelvic floor or whatever, like just because you care about that doesn't mean you don't also care about your baby and want them to be as healthy as possible. Like, we can have both. A healthy mom and a healthy baby and a safe and satisfying birth experience are not mutually exclusive things. Like, we can and should have all of it. Like, girl, you can have it all. Like, I want you to know that you matter. Absolutely. So yeah, we can't fix that other message out there, but I think that we can combat it by just telling people over and over, you matter, and the way that you are treated matters, and nothing should be done to you. And what we know about like postpartum depression and post-traumatic stress disorder, things that are very common now in pregnancy and postpartum. In fact, perinatal mood and anxiety disorders, which is depression and anxiety and PTSD, things that happen in that perinatal period. So it's like through pregnancy and that 1 year postpartum. It's now occurring with 1 in 5 people. This is now the most common complication of pregnancy. Most people don't know that. And
Absolutely.
Most people don't know that we can alleviate some of that by getting better care when we give birth. Absolutely. Because what we know about PTSD and trauma and depression in the postpartum, for birth in particular, is that as levels of intervention rise and as levels of conversation decrease, we see higher rates of depression and trauma. And so we can, so what we know is that if your birth goes sideways like mine did, and you need all of those interventions, that we can reduce our risk of trauma by talking through it.
And even like talking through it while it's happening,
yes.
But then also having the ability to talk through it on the other side.
Yep.
And that's something like I never had the experience of having a baby and then not talking to a care provider for 6 weeks.
Right.
And then walking in and being put in this, machine where they have me fill out a piece of paper that asks how I'm feeling and if I'm sad, and they take my blood pressure and they ask me how breastfeeding's going, and then they send me on my way.
Right.
And I know not all physicians
and
are
they
like
go,
that.
Oh, you can have sex now if you like.
Exactly. And it's mind-boggling to me. And once again, I feel incredibly grateful for just kind of my childbearing years, having not had to experience that. But I can't even imagine walking into motherhood and that being the follow-up care.
Mm-hmm.
And especially if a birth goes sideways or a birth goes not how it was planned.
Yeah.
Even if something as simple as, getting an epidural when you wanted to have a natural birth, or just not even having somebody to listen to you is incredible to me.
Yeah. And I have to also say that I have a lot of empathy for those providers that aren't able to provide the care that you just described, because the system is not designed for it. Like, I feel really bad for doctors that have to see 30 patients a day. Like, how can you possibly check in and tune in to each of those patients and provide the level of care that you want to? But that's just how the system is designed.
So a few minutes ago, you talked about the fact that if a physician wouldn't openly share their C-section rate, it was a red flag. Mm-hmm. Are there other questions we should be asking of our care providers that might be able to tell us, what kind of birth they may or may not be able to help us achieve?
Yeah, definitely. So I think it's good to start with an understanding as the pregnant person of what you might want for your birth, and go in with that if you're able to. Because if you want a low intervention or unmedicated birth, or birth without an epidural, and your provider doesn't do those often, and 80% of their patients are getting epidurals, then maybe that's not the provider for you. And then the flip side of that is, if you know that you want an epidural and you want to get there early and get your epidural and get comfy and take whatever interventions might come your way, then the provider that specializes in the birth without an epidural and water birth and stuff, maybe that's not the right practice for you, So start with an understanding of what you might want. And then once you have an understanding of what you want, ask your provider, and this can be the provider that you're already working with, or this can be questions that you ask when you go to interview them. You can go meet a provider without having to transfer your medical records. People can just schedule an office visit to get in with that midwife or physician to talk about things before they go ahead and completely, change their care. So start out asking them just to describe what their philosophy and beliefs are about birth. What's their approach to birth? If their approach to birth is, we get to 40 weeks and we see how it goes. And if you haven't had a baby, we schedule your induction and you go ahead and come in and I'll just take care of you and I'll just, you'll have your baby. Maybe that's not going to gel with the person that wants to be very involved in their birth process, avoid an induction, make their own choices and decisions. Asking them to just describe what their philosophies and beliefs are around birth is, I think, a really great place to start. So, sorry. We'll go ahead and at the 18-minute mark, gonna have to come back in here.
I mean, I think that's a fantastic question. It would be interesting to know kind of how that's normally responded to and processed from a care provider standpoint. Mm-hmm. Any other advice you would give in terms of choosing a care provider or finding a voice, or, I feel like all I ever want to do, and it's really hard to do through the internet, is when people reach out to us, is just encourage them, if something doesn't feel right, to open their mouths and to explore it further, because eventually the baby comes, and if you've stewed over it, or you've said, hey, this doesn't feel right, or this isn't maybe what I want, that baby's going to come if you sit back long enough and wait and don't make the change. Mm-hmm. So I, more than anything, want to be able to give people the confidence that if they don't feel like they're in the right spot, they're not feeling like they're being heard or listened to, that it really does matter.
Yeah.
And
well, so I tell people, even if you can't remember all of the statistics and the things that I talk about, the evidence, all these different things, go into it with an expectation that you should be able to talk to your provider. And if you get into that first appointment, or it's your 15th or 20th, and you feel like you aren't, like if you don't feel safe asking them questions, whatever it might be, and safe as in like you don't feel embarrassed, or maybe it's easier for me to say, you should feel confident asking your provider questions, and you should feel confident they're going to take the time to listen to you and then answer them to the best of their ability. And if you don't feel like you can ask an appointment or a question in your appointment, then how can you expect to feel safe asking questions in your birth? So start it in the appointments and trust your gut. Like if you dread your appointments, if you feel embarrassed or shy about asking questions, if you think that it's going to be a stupid question and that you're holding it in because you think you're going to get mocked or made fun of, or
you
something,
feel like you're not even
dismissed,
allowed to ask questions.
Yes, then that's, I think, a big thing to consider. So find the provider that you feel comfortable talking to, because they are going to end up being a huge part of your life, and your safety is going to be in their hands. And you really, I hope, should feel comfortable asking whatever question you might need to ask to find that confidence in your birth.
And just remember, I feel like they look at vaginas all day long.
Mm-hmm.
Like, just because they've been in your vagina
Mm-hmm.
does not make it mean that you have to stay with them forever.
Yeah.
Like, I feel like people always feel like this
Yeah.
very intimate connection
Mm-hmm.
because of the position and because of the type of doctor that they are.
Mm-hmm.
But at the end of the day,
Yeah. And I tell people, you can always go back. You can always go back for the rest of your life. For every PAP after that, you can always go back to them. They don't have to be there. And the way that most practices are designed, many physicians are only actually there for the births of between 40 and 60% of their patients anyway. So there's like a 50-50 shot that they won't even be there for the birth. So yeah, find the provider that you feel confident with. And we talked briefly about C-section rates,
Mm-hmm.
asking the provider their C-section rate. Another big one, I think, is to ask them their episiotomy rates. So I've seen
opening a whole other can of worms.
Is that a pun? No.
Oh, God.
So for anybody that doesn't know, an episiotomy is where they take a pair of scissors and they cut your vagina to open it, your vagina and your perineum. And the idea is that they're going to make it bigger and get the baby out faster. And they used to do this all the time. Almost every birth in America, they did an episiotomy, especially if it was in a hospital. But now we know, like, we have mountains of research that tell us that episiotomies are really dangerous. They don't heal well. There's higher rates of infection. People are more likely to have a tear that extends through their rectum and to have incontinence. And this is not improving outcomes for babies. So the recommendation is that episiotomies should be happening in less than 1% of people that are having a vaginal birth. Like, there are very, very few occasions when one is necessary. And I've heard a wide range of answers to this question when it's posed to providers. And I'd say like the two extremes with the answer. The best answer I've ever heard was from a midwife who said, our hospital has a 0.47% episiotomy rate. So like less than half of 1% of their patients are getting an episiotomy.
So they're not doing them.
Yes, they're not doing them, basically. And then the worst answer I've ever heard was a doctor who said, well, I'll just worry about that. You don't have to. If I think that you need one, I'll just give you one. So, like, for anybody that's uncertain, that's
But
the
you
bad
have to ask
answer.
the question. You've
Yeah.
got to find the confidence, and you've got to find the knowledge and the education to know that you deserve to ask it. And
Yeah.
know what you want as the answer.
Yeah. Really, I mean, I guess it comes back to, again, just knowing that you should be able to, as the pregnant person, ask anything that you want to ask, and you deserve a respectful answer and a provider that's going to take the time to like really consider why you're asking it and what you want to know, and give you the answer that you need so that you feel like you can make any decision that you want to.
Cool.
Yeah.
So you want to come back and talk about VBACs at some point?
Oh, yes. Yes, you know I do.
The smile's very big on that one. Cool. So thanks, Emily.
Oh,
And,
thank you.
You'll come back and we'll chat about some VBACs.
Yeah, absolutely. And if I could just say, we answer a lot of questions on our Facebook and our
Absolutely.
Instagram, and people are welcome to find me on there. It's the same handle, MyBirthRVA, MYBIRTHRVA. If anybody wants to hit me up with some birth questions.
Love it. Thank you.
Thank you for having me.